Okay, first off, I would practice my general principles and safety practices. I would verify the order to insert a catheter. I would get all of my equipment ready, come into the room, introduce myself, explain the procedure. I would ask for the patient's two identifiers, name and birthday, and I would check their wristband to make sure that that was accurate. I would ask them if they had any allergies, especially to latex or iodine. And then I would ask them if they had any range of motion issues with their legs and if they're able to flex their knees and lay their legs down. Then I'm going to get all of my equipment set up, make sure the bed is up to working standards. I would get a bath blanket to cover them with to provide privacy. And then I would also put a check underneath them in case any urine leaks. Okay, after I get that, I'm going to do hand hygiene, which I've got and I'm going to put gloves on. I have to perform peri-care first. I've got my little moist towelettes, and I would do one down one side. And one down the other side. And then one straight down the middle. Okay. Now I've done that, I'll take my gloves off and I'm gonna do hand hygiene again with the hand sanitizer. And that's when I'm going to put the sterile gloves on. I've already gotten folded a little bit here, but I'm gonna turn here and I would get my drape out. Okay, I want to lay it this way, right in between my patient's legs. I'm gonna try to grab the inside of this, move this over. Okay, first I'm going to take this part. Be careful not to touch it and put it in. And take my iodine. And get it ready. And I'm going to take my lube. I'm going to squirt it out in the I want to go ahead and get the catheter ready. So I'm going to take this part off. Careful not to touch the end of it. And we want to put lube on at least the first 2 inches of it. So I'm going to get it down in there. Alright, I'm going to go down one side. The other side. And then straight down the middle. And take this in one hand. And then I'll use this hand, and after I put this in here, it's not sterile anymore. And I would want to hold it apart. Put this in. Okay, start feeding it in there. Usually once you get it to the bladder, you'll see urine come out into the tube. Once you have it in there, good, you're gonna take this and blow up the balloon. Okay, and then you would want to pull on it to make sure that it's secure and not going to come back out. While I'm doing that, I'm going to, of course, talk to my patient and make sure they're not in any severe pain or any severe discomfort or anything. And take that off. I'm going to take my gloves off and do more hand hygiene, and then put new gloves on. Okay, so then I'm going to do the bag. I'm going to open it up, and I want to make sure it is down below the bladder level, and I also want to make sure that there's no kinks in the cords or anything, and you know, there's that nothing's clamped or anything like that, and that the bed rails can't bother the cord. My kit, I don't think it comes with the stat lock, but if I had a stat lock, you would put that on the patient's thigh. You want to clean the area really well, and you want to use a skin prep, and then put that on the patient's thigh, and then you would lock it into place on their thigh using this, and you would want to make sure that there's no pull on the catheter cord here. And then I would clean up all of my stuff, make sure once again they're not in any severe pain and discomfort, and then I would report and record.